This is what nobody tells you about newborn care. So you literally had a baby 5 minutes ago, and now what? Nobody talks about this part. And many parents feel completely unprepared when it comes to newborn medical decisions. And a lot of hospitals, birthing centers, etc., have set protocols. But honestly, do you really know what is best for your baby if asked? And that's why I created this webinar. It's all about holistic newborn care from pregnancy until birth so that you can feel empowered and confident to make your newborn decisions when you're asked. So join my free webinar and start this journey with confidence and empowerment. Hey guys, I'm Dr. Ellie and I'm here with my pod, I Heal Kids. And for those of you that don't know me, I treat kids ages 0 to 21 in and around Asheville, North Carolina with holistic pediatrics. And I also do functional medicine ages 2 to 102. And if you don't know what functional medicine is, we will definitely link that in the show notes, so check it out. So I am doing today part 2 of my 4-part mini series on baby and child poop. Yes, we're talking all things poo. So if you're interested in that topic, hang around. I know it's a really important one. And today I'm going to start with constipation. So understanding constipation in babies and kids, we really want to look at it from a conventional lens, from an integrative lens, from a holistic lens, all the different lenses, because it's such a common issue for people and people feel like they're alone with it. And truly they're not. It's so common. I talk about it all day long. You know, I had a child in my practice that really wasn't pooping at all. And they, were diagnosed with chronic constipation and they were put on Miralax and that wasn't working and they just really weren't going. And so we ended up doing like some gut testing and some detox testing and all of the rest for functional medicine. And, this kid just needed like some magnesium and vitamin C. And that child, he's 2 now. He wasn't pooping normally since like 6 months old. Now he's pooping every other day with a soft, comfy poo. And I know that it doesn't maybe sound life-changing, but truly it's life-changing because to have a kiddo that is comfortable, that doesn't have a belly that hurts every day, that you're not stressed, isn't eliminating, isn't detoxing, it's just so important. So I really just want to make sure you guys know, what is constipation, how to deal with it from a holistic standpoint. And then, we can get all into that and then figure out what to do. Okay, so let's start with defining constipation. Okay, so in a newborn or an infant, if you are having a baby that, especially around the 4 to 6 week mark, they're just kind of pushing and they're turning red, but when the poop comes out, it's soft and it looks okay. That is not constipation. They're just kind of learning how to poop. So don't stress too much about that. But if you're having a kiddo at any age that's having little pellets, almost like little rabbit pellets come out, or an older kid's big balls of poop, could be seriously, very large, like dragon's egg, if you can imagine that, that is constipation. Or if the poop is no longer a soft brown banana, which is normal in older kids, not in infants. We talked about that in episode 1. So if you're not sure what's normal yet, go back to episode 1 and listen to that. But in older kids, if you're having poop that's almost bumpy or cracked and it's not smooth, that is also constipation. And then of course, in older kids, sometimes they'll also do withholding behaviors where they're scared to poop because now the poop has hurt their bum when it came out. And so now they remember it hurts and then they don't want to go and then they hold it and then the poop gets harder and then they get more constipated and it dries out. And then when it comes out, it hurts again. And then they get in this cycle of poop. So what can happen in that case is sometimes you get what you think is diarrhea. And sadly, it's just the poop that's above the dried poop coming around and dripping down, and there's still this big blockage. So if you're noticing your child's uncomfortable, they've been constipated, but now they're having diarrhea, their bellies are distended, they're bloated, especially in older kids, that is a big sign of constipation. And then in your infants, distended bellies, discomfort, little rabbit pellets, and more than 7 days. Sometimes I want to intervene before then because babies are uncomfortable. So if your baby's uncomfortable, definitely let someone know. But in a comfortable baby with a non-distended belly who's having a soft poop every 7 days, that can be normal. I would still encourage you, like, reach out to your pediatrician and make sure, because, that is a little bit on the longer side, but it still could be normal. For older kids, what is normal? We want them to go regularly. So 1 to 2 soft brown banana poops a day. So if they're not doing that, then they're not detoxing well. If you haven't seen me talk about detox before, there's 3 ways that we detox, which is sweat, pee, and poop. And so if we're not getting the poop out of their bodies, we're definitely not detoxing. And then young babies, depends if they're formula fed or breastfed, but generally it could be anywhere from every diaper change, every time they feed, to 1 or 2 times a day, that kind of thing. And it should be soft. We talked a little bit about the withholding. If you are seeing withholding, you guys, this is something we're going to talk a little bit later in the latter part of this podcast. But we really need to work on behavioral stuff on top of helping their poop be soft. The behavioral stuff becomes really important because they now have an association with poop hurting. Another thing, you guys, that can happen with constipation is sometimes you get blood streaks. So this really will freak people out, understandably, but sometimes like the poop will come out and it'll be so hard, it actually causes what's called like a fissure, which is a little cut on the anal area. And that can actually cause a blood streak and it can really feel uncomfortable. Also, sometimes you can see like hemorrhoids from kiddos that are straining, where you see like almost like a little outpouching of the anal area, and that can be uncomfortable and cause blood. So if you're seeing like blood streaks, you definitely want to talk to your pediatrician about like, could this be constipation or something else, God forbid, because we want to fix that before a kid starts like having withholding behavior and things like that. You may also see like posturing or pain with poop. So like some kids will almost like try and like hold the poop in, or they're walking like a ducky and they're just not letting it out and they won't relax, or they're like alternatively trying to push really hard and all of that. You may see posturing. And then sometimes just straight up pain where they're saying, mommy, daddy, grandma, my belly is hurting. I don't feel good. I don't want to eat. That's another one I see all the time, is like they're just not as hungry because they need to get the stuff out of their belly. So in the conventional medical world, a lot of times, what they'll do is like the Miralax, they'll do enemas and fiber supplements. And, sometimes there are times where these types of interventions in an emergency situation are kind of more needed, or a go lightly protocol. If you guys have ever, God forbid, been hospitalized for constipation, it really can get that bad, you guys. Like you really can have a kiddo in the hospital. In fact, in my residency, there were 2 kiddos that were siblings who they just were so uncomfortable. They couldn't poop. Their bellies were really full. They looked like they were 8 months pregnant, and they had to get an NG tube, which for those of y'all that don't know is a nasogastric tube that basically pushes this fluid called Go Lightly into their bellies until all the poop gets flushed out, just to get everything back to normal. And we really want to avoid it because it's just awful for everyone. So, if you're in a situation where things aren't getting better, these may be some things that you do first before ending up in that hospital situation. Now, a lot of people are trying to avoid these, especially enemas. I really, really try to avoid them because it's another thing in the bottom. It's another thing to create an association with. And it's another thing where kids are like, everything around my bottom doesn't feel good. The poop doesn't feel good. The enemas don't feel good, and all of that. So there could be a time where it's needed, but I really try to avoid that. Miralax, there's a lot of things around like behavioral changes with that. So if your kid is having behavioral changes with Miralax, like we definitely want to get them off of it and try something different. And then fiber supplements, those can be helpful. I much rather do kind of like a natural fiber and definitely get like fiber from food, but that can take a little bit of practice. So sometimes there can be a transition time where we're supplementing until we get kind of things going with everything else. Now, where do I usually start with constipation? I'm more likely to start with something natural first. In my practice, generally, the first thing I'll try is magnesium. So almost all of us are deficient in magnesium. And it's not because you have bad food or you're not eating organic or like anything like that. It's just that the soil is generally not as healthy as it used to be back in old days when people had like better farming practices. And so we're just not getting enough like magnesium in general. And you need magnesium. Magnesium is a cofactor in a lot of chemical reactions in the body, and it helps you poop. So if you don't get magnesium, you're never going to poop. So almost everyone who doesn't poop in my practice is getting some magnesium citrate. Now, there are different types of magnesium, y'all. So if you get a magnesium salt like magnesium glycinate, it's not as likely to help with constipation. It can help with brain inflammation and other things, but constipation, not so much. So the citrate's really the one that I try to go for. Another thing we can go for is vitamin C. Okay, so we want to be careful with vitamin C in the sense of, for some kiddos, it can cause a little bit of upset tummy. So we're going to titrate up, meaning increase the dose up to the point that they're pooping regularly, but without causing tummy discomfort. So if you're doing a lot of vitamin C, and for like an older kid, it would be like 200 milligrams 3 times a day, but you want to check with your holistic doctor to make sure you're getting the right dose for your kid's age and size. Then anyway, you just want to make sure that they're pooping, but they're not getting upset tummy, and that you're getting onto the right dose that could actually help them poop. And taking it with food and things like that can help as well. Another really interesting one is rose syrup, so rose petal syrup. A lot of good studies on that recently that actually show that it works better than Miralax. So I'll link it in the show notes, but there's a great study all about how doing this syrup with rose petals had 100% effect of getting people unconstipated, whereas I think the Miralax was like 91% or something like that. So that can be an option too. And probiotics, there's conflicting information on this as far as getting a kid unconstipated, but just in the general work that I do, I think having a pre-probiotic on board can be really helpful just to make sure that their gut health in general is good, because we don't want to go down the path of like getting dysbiosis and leaky gut. So whether or not, this is truly helping for constipation itself, it definitely is helping for their microbiome. So I do recommend it for that reason. Aloe vera. Okay. So aloe vera is a stimulant laxative, kind of like senna. So aloe, senna, those are all stimulant laxatives. We don't want to use those in babies at all, but in older kids, there could be times for it, but you want to use stimulant laxatives rarely. These are the ones that are addictive. These are the ones that, if you're using it one time here or there, it's going to be fine. But if you're having to rely on it daily to have a bowel movement, that's not helping anybody out. So I would much rather start working on food as medicine, unless, we're in a dire situation where we've just got to get the poop out and start over. Then I might be recommending some of that. Things that help food-wise, I love chia for kids. Chia puddings are so good. Anything that you can put chia on and make it like mucilaginous. So like if you can get applesauce and mix chia and wait for it to get all mucilaginous, let them eat that, or make a chia pudding. That is so helpful. Anything you can throw flax on top of is super helpful for constipation. I would recommend doing it daily. And then, of course, there's your pea juices for babies, pear, prune, and peach. So if you're in a really kind of gnarly situation, we obviously don't want newborns on juice all the time. But if, let's say, they're in a gnarly situation where their belly's distended and they're uncomfortable and you need to do something, you could give them an ounce or two of pear, prune, or peach juice undiluted and help them go to the bathroom. You can also use it in older kids, and you can use purees in older kids. So don't forget that. Smoothies are great. And then any kind of stuff that has good amounts of fiber is good too. Something else we really want to talk about is hydration. This sounds really silly, but truly it happens more often than you would think, where people just really aren't hydrated. And it can happen for a lot of reasons, like whether you're hot and sweaty, or you just forgot to drink that day, or let's say you're in school all day and you're not allowed to have a water bottle or whatever it may be, and you're just not getting a lot to drink. Older kids, need like 32 to 64 ounces a day. Obviously, newborns and infants are going to be getting their hydration mostly from breast milk or formula. Around 6 months old, you could be doing like 1 or 2 ounces of water, but in general, they're going to be getting everything they need from breast milk or formula. But the older kids, we really just want to make sure they are drinking a lot of water regularly. And sometimes you do need to like put cucumber or a little bit of mashed up watermelon in their water just to encourage that they're doing it. Movement, y'all. If we aren't moving, we're not pooping. It is so true. People really cannot poop unless they move their bodies. So if your kid needs to go run around outside for 30 minutes before they sit on the potty, or go for a swim, or go for a hike, or whatever it may be, obviously older kids, younger kids, it's going to be like crawling and those kinds of things. But the best that you can, you want to do a lot of movement. In really young infants, we're going to do the moving for them. So we're going to bicycle their legs. We're going to massage bellies. You can massage older kids too, but massaging bellies clockwise really helps. And in infants, you can also capitalize on a reflex reflex where you do anal stimulation, everyone's favorite. And what that means is usually you're going to take a rectal thermometer and use the tip of it just to gently distend or move the tissue in the anal area, that anal sphincter just a little bit. And sometimes that will help a baby poop as well. There are some reflexology points in traditional Chinese medicine that you can do. I'm not a traditional Chinese medicine doctor, but you're more than welcome to look those up too. And another thing we really want to talk about is like the gut-brain connection. So obviously there is a strong connection between the gut-brain. So, especially we're going to talk about this in the last episode, but with the microbiome and the brain, if your microbiome's off, you're going to have brain inflammation. So that's one thing right there. But another thing we don't think about is like withholding due to fear or trauma. So that's another gut-brain connection, because the body keeps score. So if you're having trauma around going potty because it hurts, then you're going to withhold and you're going to have a lot of fear. So we really need to work on that. And things that you can do would just be blowing bubbles to help with relaxation, having your baby do like a little meditation with you, where you just kind of like play like the Calm app or Headspace or whatever you've got in the background to relax, listen to music, take a warm bath, do a massage, any of the things to kind of help the parasympathetic system kick in and the sympathetic system kind of calm down can be really, really helpful. In older kids, obviously talking this through. And in extreme cases, truly getting, some type of therapy or CPT can be helpful for kids that have had this as an ongoing trauma. Okay. Something I really want to touch on too is the gastrocolic reflex. So, oftentimes this is one we just kind of forget about. We're like doing all the things, we're doing the chia, we're doing the movement, and we just don't think about like the gastrocolic reflex. And so, what is that? The gastrocolic reflex, it's basically initiated by food in the tummy. So that just kind of causes the tummy to like stretch, and the stretching basically sends a signal to the colon, and the colon's the place where like the poop lives. Okay. And what happens is the colon responds by like contracting and basically like moving the poop towards the rectum, which is like the bottom of the colon where the poop like comes out. And that's where like this contraction or this like peristalsis, these waves of movement like help move the poop down to your bottom. And then what that does is it makes your rectum feel full, which is this area like right before the anus, and it creates pressure. And it stimulates you to poop. So you're like, oh, I feel like weird pressure, like gotta go potty, and then you go. And so the purpose of the gastrocolic reflex basically helps you empty the colon and make space for new food. And so you just want to make sure, like if your kiddo is, especially if they're in a pattern of trauma or they've been withholding for a while, or really even if you've been dealing with constipation for longer than a few days, just make sure they are sitting on the potty once a day, about 15 to 30 minutes after they eat. The gastrocolic reflex happens anywhere between like 15 and 90 minutes, but usually I find like within 15 to 30 minutes for little kids is a good time to sit on the potty and try to go. Now, make sure you're not like doing a thing, which is super easy to do, where you're just like getting more and more frustrated because they're not pooping and you're getting escalated and you're feeling activated and you're agitated with them. We want to try and avoid that kind of dynamic and just let them sit, see if they can go, listen to something for 5 or 10 minutes. If they can't go, try again the next day, because we really want to create like a pleasant experience on the potty and not one of stress and like tension, because then it's like hard for them to relax. Another thing to make sure too is that their feet are propped up on a little stool so they're at 90 degrees to the potty, because if they don't have like support under their feet, they're not going to be able to poop because they can't get the right pressure in their belly. So check all of that you're doing the gastrocolic reflex, you're having them sit 15 to 30 minutes after. Usually dinner time's a good time. Mornings tend to be crazy for people, but if you can do mornings, it is better. Let's move into like something that I want to talk about as well, structural issues. So this would be like something that would require a really like much deeper investigation. In babies, the big one is Hirschsprung's disease. So if you have a baby that hasn't pooped, especially in the first 24 hours of life, or very, very sluggish, most likely the hospital pediatrician is going to say, we need to figure out if your baby has Hirschsprung's. And that's where they don't have like the right nerves in their basically in their rectum area and their colon to help them poop. And that's something that needs to get fixed almost like immediately or pretty quickly so that they can poop regularly. Another thing would be like a tethered cord, like a tethered spinal cord. So like in babies, if your baby's born with like a tuft of hair on their back, or they have like a dimple and you can't see the bottom of the dimple on their back, that could be a sign of a tethered cord where the spinal cord's tethered to like that back area. And so they may not be able to poop because it's being kind of stretched in a bad way. And so you do need to get that checked to see if it needs, like a surgical correction, like the same with the Hirsch springs. And your pediatrician should be looking for that, but just for you guys to know in the back of your mind. Okay. All right. Food sensitivities and gut microbiome imbalance. All right. So, y'all know how I feel about food sensitivities. So, I'm always going to say check for gut inflammation first, because honestly, if you have leaky gut and you have a lot of gut inflammation, you're going to have food sensitivities, and you can easily do a food sensitivity panel. I'm not talking about food allergy. That is different. And I think I talked about that in a different pod. If I didn't, I'm going to do one, but I think I did. And if I did, I'll link it. So food sensitivities, if you do like an IgG panel without checking for gut inflammation, most likely your child's going to come back with like 100 different foods that they're supposedly sensitive to. And then you're trying to do this elimination diet with all this food, and it's just overwhelming and crazy, and you really don't need to do it. But if you're having like a microbiome imbalance with inflammation, that would be like a really good place to start. So if you feel like your kiddo is having like chronic constipation or issues where they're just not getting over their constipation, or if it just feels off, it is worth exploring. So I invite you, just trust your intuition, come in for some functional medicine. Like we'll do the gut test, we'll look at their detox pathways, all the things that we need to do, and we'll see if there is something that we need to address with like gut inflammation or other things in their body, like gut mind, which happens a lot, or gut skin too. Like that can be a thing too. So, just make sure you are coming in for a functional medicine consultation for that. And I do have those consultations for adults and children as well. So lastly, I just want to touch on, I am going to be doing a whole course on how to feed your baby from infancy, from age 0 to 12 months old, holistically, so that you can influence long-term poop to be normal, so your baby can detox well, and so you can create a really good gut microbiome. And so you're not getting like gut brain inflammation problems, you're not getting gut skin inflammation problems, your baby's just like super healthy from the inside out. And we're using food as medicine to treat all those good root causes. So if you need that, I will link that in the show notes when it is ready, which is very, very soon, I promise. And I hope that was helpful. Like the next one I think we're going to do in the series is diarrhea. If you haven't seen the first one on what's normal, definitely go back and see that. And I am just wishing you guys well. And I hope this little chat about constipation really helped you. And if you need anything else from me, definitely sign up for a meet and greet on my website. I would be happy to take care of you guys in or around Asheville, North Carolina. So again, if you don't know me, I am Dr. Ellie. My practice is Middle Path Integrative Pediatrics in Asheville, North Carolina. I take care of kids 0 to 21 for holistic pediatrics. And I also take kids 2 to 102 for functional medicine. And we can definitely link those in the show notes as well, so y'all know what functional medicine is. And adults, if you need it for your burnout, your brain health, for your gut stuff, you are more than welcome for functional medicine as well. Okay, hold out for the next one, all about diarrhea. Bye guys, wishing you well. Before your baby arrives, have you thought about delayed cord clamping, eye ointment, vitamin K shots, circumcision? Do you even know what you want? Many parents feel blindsided at the hospital or birth center because they didn't even know these were decisions. So I made a webinar that will cover everything that you need to know when the time comes. Don't wait until you're in the delivery room. Please sign up for my free webinar today so that you can feel empowered.